Yes, I agree. I totally agree. Like, I think it's really, really cool that they're located right beside Georgetown Hospital. Like, that's amazing. I remember when I first came in here, I'm like, I have to be in the wrong place because the way the practice is kind of facilitated, it's like you have the hospital right here, and you've got to kind of just go across the bend and go all the way straight. So it's almost like on the opposing side, and you're just like, like I must be in the wrong place. You see kind of like a field. And again, in Georgetown, there's a lot of farm area and so forth. The community, like she said, is amazing. I love interacting with them. You have a lot of big personalities, as I said again, that's what keeps me going. But what I really like about this practice is, and what I really appreciate from this practice is they really enforce the polish prior to the scale. Now, I know majority of offices, we have a routine where we go in, we do the medical history, you get the Listerine and so forth, and then you do the scale, and then you initiate the polish. But I found that there's a lot of less strain when you do the polish prior to, and then you go ahead and do the scale, right? So we don't get that fatigue as a clinician, right? And I really do appreciate it, and I like that they do that. They always do the chlorhexidine rinse prior to, not the Listerine. And then they go ahead with the polish, we do the scale, and then that's it. So you don't have to repolish or anything, you did it prior to. So yeah, so I just love that about this practice.
You know why we do that, Reza? Rosa, you have seen so many articles come out, like it says that heart disease is related to the mouth, diabetes is related to the mouth. So in order to prevent all those bacteria getting into our body, we do a pre-rinse. That's a chlorhexidine, and it's an antibacterial rinse. Why not? Why not get the bacteria away before we inject it? So we rinse it with it, and then the plaque, which is nothing but the microorganism which is built on the tooth, we polish them. It's like going and sweeping the floor, getting all the dirt away first before we start cleaning it. So now after we do the polish, we do the scaling, that is called the taking out all the calculus of the pattern. So this helps all the bacteria which is going into the bloodstream and prevents it getting into the bloodstream.
Yeah, it helps reduce the amount of microbes and bacteria that a patient is exposed to prior to initiating scale. I love it, and again, as a clinician, it really minimizes the amount of strain, and I'm thankful for that because it just makes your day just a lot smoother. It's a lot, yeah.
Yeah, and patients are happy. They do see the difference, yeah. And they come back and they say, wow, this worked. So every day,
pass it on to Dr. Rajanna. She's gonna steal the show, and just stay tuned for just a little bit more insight on how bleed.
This is what I'm going to explain about the mouth and the body connection. Here you go. This is the mouth. The mouth has the bacteria from the tooth can enter into the bloodstream. This is the bloodstream. And from the bloodstream, if you're at high risk of any kind of diseases, it can go into your heart, it can go into your liver, and also when you're pregnant, it can get into your little baby too. So our goal in Georgetown Dentistry is to diagnose, stop, and treat the mouth diseases.
Oh, hey guys, don't forget to like, share, and subscribe, and check out Georgetown Dentistry. They're great. Bye guys. Alright, hey guys, it's Rosa with you again. We're going to do a review on this Monsters brand fluoride varnish 5% sodium fluoride. Do you have any questions about this product prior to me applying it on your teeth?
So what exactly does it do?
That's an amazing question. So it does 3 things. So number 1, it helps prevent cavities by emitting sodium fluoride into your teeth. Now this is the varnish, which is more superior than the rinse or the foam, right? Because it's gonna sit on your teeth,
okay,
and it's gonna emit the sodium fluoride. So that's what that remineralization and that substantivity, that period of time, is what allows it to prevent the cavities. It's good for demineralized areas, which means, for example, say you have like a white spot on your teeth, it helps kind of camouflage that area, and also it helps with sensitivity.
Okay. And how do you put it on?
That's a good question as well. So we're gonna have to dry the surface of your teeth completely.
Okay.
So essentially we're trying to eliminate any moisture, any saliva, and then we go ahead and we apply the product. I'm gonna open this product up here so you can see the inside. And tell the viewers what you see.
I see like this little tiny paintbrush type thing, and this thick white liquid.
So that's the paintbrush, and this is the paste here, the fluoride varnish. It's very viscous, thick. Okay, and this is the strawberry flavor, right? And let's just show them the brand here if they want to see it up close. And it's not expired, so we check the expiry date. It's always important to check the expiry date. Okay, and what does this smell like to you? So it's supposed to be strawberry, and he's gonna tell us if it is, if it's not. What does it smell like?
It smells like strawberry.
It smells like strawberry.
Yeah,
There's some.
that's strawberry.
Oh, it smells sweet. It
Yeah.
smells like a sweet strawberry.
Like I want to eat it. It
Yeah,
goes in my
right?
mouth.
Oh, I would eat that too.
Yeah.
All right, so we're gonna apply it, and he's gonna give us a review on like the taste, the texture, and give us some more commentary. We do have the 5%. All right, so we're just gonna dry the surface of his teeth and apply the 5% sodium fluoride varnish by painting it on, making sure to cover the entire surface area. And we're gonna do the same thing for the lingual surface. Just make sure it's all dry. Have them stay open. Apply more product. Even use your mirror if you need to come in, just so you can see the aspects very well while you're applying the product. Okay. Alrighty, so what's the verdict on the varnish? How would you describe the texture?
The texture, I feel it's very intense, and it feels rough a bit, like on my teeth.
Yeah.
But like it really adheres onto my teeth, so
Yeah.
like it feels like it's on there, like it's
stuck on there.
It's stuck on, yeah.
Yeah, so that's the great thing with the varnish. It really has that that capacity to really adhere to your tooth structure. So for younger kids, it's great because they're not swallowing it, and they still get that that fluoride constantly and continuously emitted into their teeth. And yeah, it does have a gritty texture, so you do feel that. And the flavor, how would you describe the flavor? Like, is this something that you'd passively be like, no, I don't really want to take it, or I might want to take it? Like, how do you describe the flavor? Is this something that you like putting in your mouth?
The flavor is really good.
Yeah?
I would like putting this in my mouth, yeah.
Yeah?
It tastes like there's real strawberry in my mouth.
Yeah?
Yeah.
That's good. And one more question. So, to me, it smelled really, really sweet, like candy sweet. How, like, does it taste as sweet as it smells?
For sure, if not more.
Okay. Alright, thank you for the commentary.
You're welcome.
Alright, have a good one.
You too.